and support our YouthLead activities. Before we get started, I'm just going to offer a quick background about Youth Power Learning and YouthLead. Just so you know who the rest of us are, our team includes Cassandra Jesse, who directs Youth Power Learning, Maria Brinderweil, who is the coordinator for YouthLead, Rachel Stepka is our communications manager, Abalaji, of course you know, knowledge management and communications. We also have Ikene Anyadika, who is our knowledge management and communications, and Nalima Raut recently just finished her role with us, but we have a great team that supports all of the YouthLead activities. As background, YouthLead is a global network of more than 6,500 young changemakers from around the world, and it began as an activity under the USAID-funded Youth Power Learning project. Youth Power is focused on sharing knowledge, learning tools, best practices, and what works in positive youth development. If you're not familiar with the term positive youth development, or PYD, this is defined as including 4 components. The first is that youth have assets, and they should have the ability to leverage those assets through agency. They should also have the ability to contribute to positive change for themselves and their communities, and to do this, youth should be surrounded by an enabling environment that supports them. When it began, Youth Power Learning's main focus was on supporting youth-serving organizations, including those that were implementing programs around the world or carrying out youth research. With YouthLead, which was launched at the World Bank's Youth Summit in December 2018, the focus was put on young people themselves, and with the goal to provide connections and support for youth-led and youth-serving organizations. The vision for YouthLead is to serve as a global hub for young changemakers ages 15 to 35, with the goal to enable them to maximize their impact through networking, mentoring, and access to information. The platform offers a great opportunity for young people from different countries and different networks to get inspired, to learn from one another, and to connect beyond their traditional circles and benefit from diverse resources and information. The site is available now in English, Spanish, and French. There is also Google Translate on every page, so it's available to a wider group of youth around the world. The last thing I want to share are some of the activities we've been undertaking lately. Of course, in response to the challenges presented by the global coronavirus pandemic, we've been leveraging the power of our global network of young changemakers to share critical information and to channel their leadership skills. So we've done this in a few ways. The first is to create an information page on COVID-19, what you need to know page that has resources, information about how to stop the spread of the coronavirus, safe practices, as well as resources focused on key issues like mental health, emotional well-being. We also have launched a Youth Stop the Spread call to action campaign. The page includes information and a social media toolkit that YouthLead members can use to help spread messages around hand washing, social distancing, and combating misinformation. But on Friday, in recognition of Global Youth Service Day, we also expanded this campaign to what we're calling Youth-Led Acts of Good. This is really to push this campaign to combat COVID-19 beyond just the YouthLead platform and connect to youth networks around the world, and to invite young people to share with us one act of service or one act of good that they're doing in their community. So if you'd like to learn more, we invite you to go to YouthLeadorg. The last thing I want to say is that the site is also highlighting actions that young people are already taking around the world to fight the coronavirus, as well as our YouthLead partners, so organizations that support young people. So again, just encourage you to go to our website, check out the resources, and explore how you can engage and support these campaigns. And with that, I'm going to turn it back over to Abalaji and to our speakers for this webinar on how youth can leverage tech to advocate for SRHR and gender equality in the COVID-19 pandemic. Thank you so much to our speakers for joining us today.
Thank you very much, Sarah. Thank you for the introduction. Thank you again for everyone who's on the call. My name is Abalaji, like Sarah earlier mentioned. So we're kicking off our YouthLead Social Issue campaign today, and we're starting with our 2 wonderful YouthLead ambassadors, Asunile Kotu and Bran Mafuso. The YouthLead Social Issue campaigns are a short-teamed campaign led by YouthLead ambassadors themselves. The goal of the campaign is to provide them a platform to be able to champion the social cause that they are particularly passionate about, which in this case technology and SHR. As we all know, as the world continues to battle with the coronavirus, technology plays a huge role in helping people to stay connected and empower us to be able to continue our change-making work and also impact our communities. Our YouthLead ambassadors, Kotu Asunole from South Africa, and then Brian Mafuso, our YouthLead ambassador in Ethiopia, will be taking us on a conversation on how youth can leverage technology for SRHR and gender equality amid the COVID-19 pandemic. Kotu and Brian, welcome on call. I think I will hand it over to Brian, who will be taking us directly into the presentation for today. Brian?
Okay, thank you, Sarah. Thank you, Abolaji. My name is Brian Mafuso, and as mentioned before, I'm a YouthLead ambassador, and I'm currently working with UNFP volunteering on SRHR and policy and advocacy, the other part of that. So before I start the presentation, I would just like to start with a quotation from the late former General Kofi Annan, who once said, and I quote, "Gender equality is more than a goal in itself. It is a precondition of meeting the challenges of reducing poverty, promoting sustainable development, and good governance." Now, today we're going to be discussing on how COVID-19 has also impacted SRHR and gender equality. And what is important to actually note is that we, before this pandemic, already had a pressing issue of vulnerable populations. And when we talk about the vulnerable populations in society, we have the poor women, the Black women, Indigenous women, rural women, LGBTQI individuals, adolescent girls, and young people. But
Brian, looks like you went off. We lost you in between, Brian. Can you hear me?
I hear me now.
Okay, yes, great. Can hear you now.
Okay. So yes. Okay. So I was talking about the toll on the COVID-19, and I was saying that globally the COVID-19 has taken hold of critical our routine services such as STIs, antenatal care, contraception, and abortion, which are the ones that have suffered significantly in this pandemic. Now, in the next slide, we have to actually understand where we are going and what we've been saying in the SRHR and the gender equality movement. And what we are saying that the transformative results that UNFPA gave us in this movement was that we should be able to achieve a state of zero maternal deaths, preventable maternal deaths, zero sexual gender-based violence and harmful practices against women and adolescent girls. And when we talk about this, we are talking about an end of child marriage and female genital mutilation. And the last zero being zero family planning needs. The need why I speak of these things is we actually have to also understand some of the things that we are aiming to do. And now the COVID-19 is putting us in a position where these transformative results are also being under threat, and some of the progress that we've made is now almost being eroded by the situation that is occurring. So if you can go to the next slide, Abolaji. So now I go on to the challenges. I have talked about, if you are keeping in mind the zeros that I've talked about, you find out that now currently the situation is that there have been imbalances in the healthcare provision, shortages of medical supplies, the distance of traveling costs, especially when we talk about young people and women from rural areas. Now, for example, the prices now are being that they are paying for transport fees to go to a healthcare center are exorbitant, mainly because there is limited movement, and also you talk about fuel stations, they're closed. So this results in also increase in the travel costs and even the distance now. And of course, last but not least, we talk about the loss of income and poverty, powerlessness, which has been linked to so many challenges in terms of SRHR and also gender equality as a driving force to all of these things. And of course, that there's been an increase in violence and inequality against women and girls. Next slide, please. So I think some of these things I've spoken about them in the previous slide. Now, you find out that, like what I was saying, there's pressure on essential services because of also a lot of healthcare. The healthcare system is actually attending to most of the needs of people. For example, when we talk about the security sector, most of the police and health personnel are either manning roadblocks, or the healthcare system is actually focusing its attention mostly to the COVID-19 pandemic, especially in the cases of Africa. Now, this now makes a pressure on the health system and restricted movement. These are some of the things that have caused the situation to be worse. And you find out that the impact on the contraception access and the stockouts reports have been recorded. The shortage of condoms, of essential contraception for women, and also lack of necessary medication due to shipping delays and active ingredients, because the chain has been distorted in terms of like the value chain of actually making these products, the raw materials and all that. And now the pharmacies also are reducing trading hours, and family planning clinics are closed also, which means also those emergency pills are very difficult to find. And in some cases, not only just talking about that, but the other contraception that might be needed. In the right side of this slide, you'll find there's a newspaper that I actually put, which was, I think, put last week. It's a Zimbabwean newspaper that talks about the latest crisis on the drugs disappearing and prices also soaring. So part of this is also, we wanted also to focus on the gender-based violence side. UN Women lately reported that there has been an increase, a sharp increase also in the number of domestic abuse and sexual gender-based violence. The major victims being young women and also adolescent women, and also women in that kind of regard. Now, what this presents also is that the challenge in that is that victims of gender-based violence cannot have limited access to actually approach structures that are in place normally. Like, for example, in terms of the police, it is difficult to actually get the police also to have justice that is swift for the perpetrators, because now the police station would be closed, the courts would be closed, and some of the services like psychosocial support would also be closed, which means now this would present very, very big problems to most young people. And also in Africa, in most cases, we also speak about even under lockdown, the victims cannot go anywhere, and most of the times the government also has limited capacity to actually help them in terms of giving them accommodation and also trying to sort out these nitty-gritties. And yeah, it goes again to the limited access to services, help desks, hotlines. Some of these things in some of the African countries have been distorted because of the way of our system. Like in Africa, it's mostly usually paperwork. The virtual part is never really done. So the next slide. So I'm going to leave to Asonel to actually give us the role of technology, how we can leverage on it to actually address this problematic issue of lack of access and gender-based violence that is happening, because that is also being exacerbated by the COVID-19 case. Thank you.
Thank you very much, Brian. Kotu, you've been unmuted, so you can go ahead and continue your presentation.
And thanks, Sarah. And thank you everybody else for joining us today. So basically what I'm going to talk about is just to take you through on the role of technology with regards to the topic that we're discussing today, which is sexual and reproductive health and also gender-based violence. Just to give a little background about myself, my name is Asonele Kotu. I am the founder of FemConnect, and what we do at FemConnect, we created a mobile technology app that allows women to access contraceptives through the mobile app, and it also helps young girls to benefit with regards to getting donations digitally for to help them with sanitary pads, and also to help lessen the burden and the problems that we have around period poverty. So to jump in without wasting any much time, the role that technology plays in our life is going to be very magnificent in the months and years coming forward. We've been talking so much about the fourth industrial revolution and how Africa can gear up itself to be ready for the fourth industrial revolution. But since we've had COVID-19 step into our lives, we have had to kind of fast track things and fast forward to get to the place where we needed to be in terms of implementing innovative solutions that help us live our livelihoods the way that we would normally do. So how would technology help us with regards to getting access to sexual and reproductive healthcare services and products? What it does is that it creates accessibility to essential services, which means as people in the world globally, there's about 5 billion people that have access to mobile phones, that are using cell phones. So what technology does is that it enables us to have much more convenient services. It enables us to get more information and easier access with limited barriers. It also helps us to make informed decisions about the things that we purchase. But since we are in the age of COVID-19 and there's lockdowns and we cannot have face-to-face interaction, technology then plays a large role in becoming the middleman between the communication of the end user and the communication of the supplier or whatever health service provider you are. And on the other hand is that if you are a civil organization or if you're a government organization or private organization, how technology helps you is that it can help you amplify the work that you do through digital advocacy, and it can also help your end user, it can help you educate your end users around the work that you do, the benefits of the work that we do. Once again, it goes back to the part where we are empowering the end user to know what they are using, to know what it does to their body, and also to create easier interactions between us and them without having to travel long distances, without having to pay a lot of money to get things. Okay. So basically, this slide basically gives you a picture of how we're doing things currently now and how we will need to start doing things with the integration of computers and mobile phones and everything else that is regarded as technology. So currently we've got doctors, hospitals, pharmacies, and clinics where we go to access our contraceptives. And usually what would happen is that a person would go to a clinic and then you wait for a couple of hours. The sister checks you, she checks your high blood, she asks you a couple of questions, and then you would get your contraceptives and leave. But now, as my colleague Brian mentioned earlier on, some family planning clinics are closed. So that process does not happen. And you cannot just walk into a pharmacy and say, I'm looking for an Evra patch without having a prescription. So what is happening currently is that with people that cannot get this kind of services because of the limited mobility, they then sacrifice getting their contraceptives and not go at home, which then leads to the dangers of getting high pregnancy rates and unplanned pregnancies and sometimes unsafe abortions. What we also have currently is civil society organizations. We've got shelters, we've got safe houses, but also there's a process to get into there. For example, if you are being abused in your house and you need to go into a shelter because you're running away from the perpetrator who stays with you in your house, when those shelters are open, it's easy for you to walk in. But now we once again in a lockdown, it's difficult because these shelters are closed. Some NGOs are not even operational. The hotlines that you would call are not even operational. So where do people go at this time when these institutions are not functional and they are also being placed under lockdown? Once again, for young girls that depend on the donations of sanitary pads, they usually access this through schools, through churches, through youth clubs, through whatever interaction systems are not functional as well. And then we've got the police, we've got the hotline, we've got the call center helplines and the SMS lines. These are things that we have been doing, and these are systems and structures that we've been abiding by. But then since COVID-19 has come into our life, it changes everything. And it's not like when there's a solution to the virus, all of these things will get back to normal. We are not getting back to normal. We will then have to find ways to integrate technology and move forward to simple and convenient ways. And the convenient ways that we can look at are maybe looking at virtual medical assistance, telehealth, where some first world countries, you can actually purchase your contraceptives online. And how you do that is that you go into a mobile app or into a website, you do an online questionnaire, and a doctor who's on the other side will then give you a screening questionnaire. You answer that, they evaluate it, and then they would prescribe something called an e-script, which then means that you can get access to the contraceptive that you need, and it will be delivered into your own home. The same way that we purchase food, the same way that we are buying many things online, we can also do that with health-related products that we need as women. And for example, now that we don't have any shelters, maybe we could have walk-in shelters where people just type a message to the shelter to say, I'm in trouble. The message could have maybe a secret code, and they would walk into those secret shelters that are in their communities. Pop-up support centers within retail stores that are operational at this point in time, because we know that retail shops are open so that we can go buy groceries. And most of the time, people that are in abusive situations are the women, and they would then go out to do the groceries. So imagine if we could have pop-up digital stores or pop-up stores at the different retail shops where a woman can know that, okay, I have this problem, I can go shopping, and then there will be these person that will be assisting me. We've seen a rise of online, if you can go back, we've seen a rise of online websites and platforms where people can report cases, and we've seen apps where women can purchase products and also can get information that is related to their services, including online counseling services and legal services and online sanitary drives. If you can go to the next one, please. So that is the direction that everything is going to, because everything will have to be digitized because of the lessened interaction or lessened personal interaction. But we can look at all the examples that we see in first world countries, but how do we know if these will work in our context or in our country? Because there's no one solution that fits all. So what we need to do is we need to work together between private, public, and government institutions because not everybody has access to the technology, and not everybody has access to connectivity Because once again, if you are in a rural community, the chances are if you have money, you will choose to buy bread over buying data for you to connect and get information for whatever reasons. And the fourth reason is that there are not many people that reside in the communities that we serve, or in the communities that need these services most, that will have laptops, Wi-Fi connections, mobile phones, and so forth. So there needs to be a lot of investment that is done towards developing technology infrastructure, and also investing into people being educated how to use these technological platforms for their own benefit. If you can go to the next one. So we look at how COVID-19 is also affecting period poverty. We've mentioned the effects on gender-based violence. We've mentioned the effects on access to contraceptives, but there is one thing that we have not been looking at on a large scale, and that is for young girls that are dependent on donations or on the system with regards to getting their sanitary pads. Just because we are on lockdown, going on your monthlies doesn't stop. It doesn't go on lockdown. So how do we continue helping young girls and continue the sanitary donations? Because traditionally what we do is we have a group of churches or NGOs or ladies at school that would then go around and ask people to donate, and then they would physically deliver these things to, or deliver the pads or the tampons to young girls. So what we have started doing is to start something called a digital sanitary drive, where young girls can register information on our mobile app, and they can say, I am Cindy and I'm based in Joburg and I need a pamper pack, or I need sanitary pads. That then gives us data to say, okay, this is the need in Cape Town, this is the need in Joburg, this is the need in KZN, so that we know how much we need to supply. And that's once again another positive aspect of technology, because it helps you to gather the data in order for you to analyze how much supply you need to put into different areas. And it also gives you an overview of the statistics that we usually don't have in hand, so that we know what is the need that is out there, and what are the mitigating strategies that we need to put in place to cater to these needs. And if you go to the next one. So as youth leaders and as change makers in your own areas, what can you do to ensure that you are doing something to help that we're facing? And one of the things that is very easy, which we can all do, is we can nominate ourselves to be a point of contact for for women in our communities. We can start safe space WhatsApp groups where you know that you will check in and you will disseminate information that will be useful to women that you think might be in abusive situations. And this can be educational information that will also enable the person to know where to go, or resources that they can read. And it also offers, it gives the person another outlet to reach out to, because if you look at how things are, we are all stuck in our homes. And imagine if you are in an abusive home and you're stuck in that situation 24/7 for 21 days, which we've been locked down for. It is quite difficult. So it is very important to constantly reach out to people, to constantly send out information, and to constantly educate people to say, these are the tools that are available. This is where you can get help, because we want to create hope instead of finding many women that are depressed and will end up in suicidal cases. So if you can go to the next one. So I've pinned down 3 tools that you can reach out to, or that you can share with people that you think might need assistance, or people that might need more information. The South African government and the Social Development Department have created a gender-based violence command center where women can actually call in, or you can text a message, or you can speak with somebody via Skype if you feel that you are in an abusive situation and you need to talk to someone, but you do not know how to get out of it. There are qualified people that will be able to help. And then if you need information that is factual around COVID-19 and what is happening and updates, the World Health Organization has a WhatsApp line, and I've included the line there, which you can join, and it gives you daily updates. You can search whatever information that you want to read, so that you are on the same page with the rest of the world, and that you're getting are needing sanitary pads, they can also go to the Google Play Store and download the FemConnect app, and then just mention there, if you are in need of a pamper pack or sanitary pads, send us your information, tell us where you are, so that we can also try to find ways that we can reach out to you and get things to you using the technology that we have. And if you can go to the next one. And as we want to continue this conversation, and we don't want it to stop with this webinar. So this campaign is ongoing for a whole week, and we'd like to invite those who are on the call right now and those who've missed the call to join us tomorrow as we continue as to how do we go about, as young leaders and change makers and people who want to, or people who aspire to do something in their own communities, how do we all go about together to create the changes that we are talking about here, and how do we give practical advice, and how do we become helpers of those who are in need out there? So that's it from my side. Thank you very much. I'm gonna hand over now to Dr. Shakira Tunara, who will then take you through this particular slide. Thanks.
Thank you, Kotu. I'm not sure we have Shakira on the call at the moment, so I guess, yeah, I'm just trying to look around. I don't think she's on the call right now.
Abulaji, I am here.
Oh, okay. All right, Shakira, I didn't see it. Please go ahead, Shakira.
That's fine. Abulaji and everyone listening in, it's brilliant to be here. A huge congratulations to Ambassadors Brian and Asanele. I think, you know, this is the one webinar on gender, SRHR, and COVID-19 that I think has come together so succinctly. So congratulations on that. A very quick coming in, I suppose, and thanks for the invitation, was to bring in a bit of a reality perspective based on some of the work I'm involved in the continent. And really looking at Africa, you know, I wanted to bring in the reality perspective, because I do believe that, yes, we are quite fortunate as young leaders listening in, having the privilege to host webinars. And there's definitely the potential and the turning of the century, which sees us leveraging digital technology for sexual and reproductive health, but also more generally our development world. Where do I see the synergies? I think that during this time, while we focus on COVID-19, it's also very important to remind our decision makers, to remind those who are in power, that there are commitments to keep sexual and reproductive health services going, whether it's contraception, whether it's antiretrovirals to people living with HIV, or whether, as Asanele pointed out, gender-based violence services. In Africa specifically, it's very important because so many commitments, specifically the Maputo Protocol, set 2020 as the year to achieve targets. So we need to also use this opportunity to remind people about the commitments to the targets and hold accountability and transparency. I then also, you know, I started off saying that I wanted to bring in the reality perspective. And for example, while organizing virtual consultations at the moment in South Africa, I have some young leaders who are students who reach out and say, Shakira, I cannot participate because I don't have data, or the place I live in is just too far away. So I think a wake-up call to many of us is, in order for us to leverage this power, and in order for us to leverage the action, we need to make sure that we truly aren't leaving people behind, because right now, young women, girls, and those who live in rural areas, unfortunately, do not have access to technology. So I'd end off by saying, and you know, sharing some food for thought. If I'm not mistaken, I picked out the statistics from either the World Economic Forum or World Bank, but we cannot ignore the fact that some of us have the privilege to go virtual, but 44% of the world's uncovered population who do not have internet access, and who are actually those who suffer from SRHR, poor services or not having access to SRHR reside on this continent. And I'd leave you with those thoughts. Very quick thoughts, and thanks for having me.
Thank you very much, Shakira. I honestly didn't know you were on the call. Thank you very much. So I'll be advancing to the question and answer session, and then we have a few questions here from the audience. First question is from Derek, and Derek's question is, what can we do to make sure that boy child is not blamed for GBV? If I can start with Brian, and then we can then Kotu can also go ahead. Brian?
Thank you so much. So I think the question for me was not quite clear, because but I would want to also ask a little bit of clarity, like when he said that the boy child is not blamed for GBV, because I think when we talk about these issues, they're always like two sides of it. I think there's another perspective where maybe I think he's talking about like inclusion of also the boy child, also in issues of gender-based violence, like maybe they can also be what you call it, victims also of gender-based violence. So in that regard, I would say that it's also very imperative also to have sort of like an inclusion of both boy and girl child. Despite, I think the perspective that we are coming from is most of the times when gender-based violence happens, it's usually the women and girls that are most affected. So that's why usually a lot of people, when they speak about these issues, they tend to be more to the women's side rather than to the male side. But we do recognize that it can also happen. And I think that what would be important also is, like what Shakira was saying, leaving no one behind, and also making sure that the same things that we are applying also to young girls also are applying to young men and boys. Yes.
Thank you very much, Brian. Kotu, do you want to also chime in on that?
So it aligns pretty much to what Brian said, because usually we see a lot of initiatives that are focused on women, and maybe it's about time that we include more male advocates also to speak around sexual and reproductive health, and also to educate boys about these topics. And we need to change the way, because traditionally, if you look at the interventions that are being done at schools, you would find maybe it's a group of girls that are being educated about stuff that have to do with their sexual health. Why are we not including boys in those conversations from a very young age? And there are various organizations such as the Sonke Gender Justice who are focused on the boy child and also changing attitudes of males so that they take accountability and responsibility for cases where if they see abuse, they have to report it. So I feel that we need to do a lot of work as well around that area. We need to include more males. We need to do more education around how men in general and how male children can treat women differently, and how they can not become a statistics of a typical abuser. So yeah, very much what Brian said, but also we also on our side as leaders need to focus on educating the boy children too.
Thank you very much, Kotu. I also have a question from Hamel Sylvia. Amel's question is, how can we help girls who do not have access to technology or phones and living in remote villages during this period? Brian, do you want to go first again? Brian?
Yes. Okay. So I mean that's a very good question, because I mean when we were discussing about this webinar with Kotu, I think this is one of the things that we also she highlighted also in her presentation, that in most areas now there's difficulty in terms of like accessing internet, and also it goes again to the same point that Dr. Shakir was talking about like 40% not being able to access some of these things that we are now seeing as a privilege. But what I can say is that I think the part in our webinar also, we also discussed like what the role of us as young leaders, what we can do. Like we know that there is limited access of internet, but there are some other maybe traditional, while it's also we are pushing the government to say, can we have more internet connectivity in this area and network? I think there are some traditional things that we can do for now that could not take time, but would need to, for us as young leaders also to engage in terms of like letting, what you call it, letting those people that have access to the community know about like the COVID-19. For example, we talk about PA educators using those traditional mechanisms, of course, while it's also observing those principles of social distancing. So that's what I can say. I think that for me, that's the solution. Use the traditional structures and the community structures to actually respond in terms of educating other young girls about all these issues, while it's also advocating on a national level to say, let's have internet, let's have access.
Thank you very much, Brian. Kosu, do you also want to jump in on that? Hi, Kosu.
Sorry.
Yes.
I was just battling with the mute button here. So basically on my side, I think what we need to do as youth leader, as civil society, and those people that work towards helping the less fortunate, we kind of have to step up, because unfortunately the fact that the technology is not available in rural communities is not something that we can fix overnight. But what we can do in our roles is we can still be the voice that communicates with people, which means we need to play an active role in being the listening ear for ourselves, our organizations, and also for the communities that we serve. And we need to find ways to take that information back and disseminate it back. I know the bare minimum that many people will have in rural communities would be WhatsApp. So let's utilize WhatsApp groups as much as we can, because there you can still disseminate information that is relevant, that is factual, that is educational. But at this point in time, we kind of have to take the brunt on ourselves and find solutions and start implementing the solutions and be the voice from the voice that takes the information and brings it back to the people.
Thank you very much, Kotu. I think one other thing communities, for example, without access to internet can also do is to explore the text messaging, for example, USSD. How can communities continue to communicate even using text, ordinary text messages or USSD codes? For example, they could dial a number and use star XYZ or star 1234, and then they could get prompts on how to provide services for them, or who, for example, needs a particular services. This is something I think some communities in, for example, in Africa, especially in Nigeria, are also doing. So I think that it's a good way to also explore. So I would also like to ask just one more question, and I'll be putting both Brian and then Kotu on the spot here. Kotu, I would start with you. Who are your SRHR heroes right now? It could be an organization, an individual, and why are they your heroes?
So for me right now, I look at the organizations that are around my area and in my communities, and also the organizations that are actually doing a lot of work. And I would say FP 2020 is one of my heroes, because I'm super passionate about the contraceptive thing and the work that they are trying to do on a global platform and to also transform various countries. On a local level, I would say I actually like SHRH Gender Justice a lot, because of the work that they are doing in collaboration with boys and also educating older men that have been abusers, and they're trying to rehabilitate them. I love their approach in what they're doing. And every other person on YouthLead that Yeah,
Cool.
so those, yeah,
Thank
the
you.
local heroes too are my heroes.
Thank you very much, Kotu. Brian, would you also want to tell us who your heroes are and then why they're heroes in this sector? Hi, Brian. Here you
Hello?
go. Yes, I can
Yes.
hear you now.
Okay. So I would say that on organizations, I think that UNFPA is very close to my heart, mainly because UNFP has a way of has included young people in its agenda, and the way that it has also implemented and supported young people's organizations. So I think that it makes it a hero organization. And I think also on individuals, I would say we talk about also Dr. Shakira, who's in YouthLead. I think she's my hero in that she's one person, the young person that is passionate about leading change, and also she's also open to every young person from different backgrounds and skills, and I think that's what also makes a very good person. And lastly, I think in the African Union, there's Commissioner Sarah, who heads up Human Resource Science and Technology, but also the Youth Division. I think if you would also meet with her, you'd agree, because she is also one person that is also passionate about young people in the African continent, and always speaks the truth to governments. And yeah, so I think those are the people.
Thank you very much, Brian. And then this will be my last questions, and then last question I can wrap up. And I'll be throwing this question to Dr. Shakira herself. Shakira, if you were given a platform to address the world problem right now, to basically advise the youth right now, what advice would you give to the youth, Shakira? Now I have to look for Shakira. Are you still online? Oh, on mute. Okay. Yes, you've been unmuted, Shakira.
Abulaji, I'm glad to see now you're finding me. I'm no longer invisible. Yeah, I think at this time during COVID-19, and Asanela touched on it a little bit, I think peer support is so important. Each of us need to check in with each other, be there for each other, and quickly to respond to some of the questions of how do we include those who do not have data in these discussions. And I'm actually facilitating a discussion tomorrow. And I was so proud and so excited to hear as a board member of this organization that they allocated a budget to make sure that youth at the grassroots level could tune into discussions. So those are just some ideas. And I think we don't have all the solutions, but let's continue working together and drawing on each other. And, you know, the motto that we follow is youth power. Thank you.
Thank you very much, Shakira. And I think I have a contribution from Ronald. Ronald, I see your hands up. I have given you microphone access, just in case you want to speak.
Okay, thank you very much, Abulaji, for this, important webinar, which is coming at this particular, critical moment where, as a globe, we're faced with this global pandemic of the coronavirus. So I would also like to thank, Asonele and Brian for a wonderful webinar. And I also resonate with what Dr. Shakira was also speaking about in terms of us as young change makers being able to also hold our leaders to account in terms of, the provisions and resources that they are also channeling towards health. And adding on to what she was saying, I would also love to say, most of our African states, they are also even failing to meet the 15% of their national budget allocations to ensure that their health facilities are well in place. But of course, that's advocacy that we must be doing, in the long term. But at this particular moment, I would also love to say that it is also, cumbersome upon us as young change makers to ensure that we utilize, the current, structures that are also, existing in our own communities to ensure that all these discussions that we are having, they must be put in simpler terms in local languages to ensure that, you know, even those who are not accessing internet at this moment are able to, you know, also benefit from these discussions. So yes, this is a very important and critical discussion, but we must also ensure that we are utilizing those lower structures and the already existing structures to ensure that, you know, more young change makers do access this important information. Thank you.
Thank you very much, Ronald. So we were already running short of time, so we'll just be advancing to the next slide already. So thank you all for your wonderful questions, and I also want to thank our panelists for this very wonderful and interesting conversation. If you have not yet joined YouthLead, I encourage you all to do so. You can basically join the platform by visiting www.youthleadorg and sign up for an account. As a member, you can post content on the platform, share your resources, share your knowledge, either through blogs, short videos, or event funding opportunities. Or you can also participate in our discussion groups where you can also meet other young change makers like Dr. Shakira, Ronald, and also even our YouthLead ambassadors on the platform. Every month, we also send out newsletters to our community members. So if you signed up on the platform, you definitely get our newsletters. And then for every contribution you make on the platform, you earn points for your contribution. You can follow us on our social media handles on Twitter, Facebook, and of course, on our website. Tomorrow, this conversation will be continued. Sonole Kotu and Brian Mafuso would be continuing this conversation tomorrow on Twitter. So please sign in, join the conversation tomorrow, and let's continue to speak about this on Twitter tomorrow. I also want to say a very big thank you to our various sponsors who have also been promoting YouthLead to their various youth network and also contribute to resources, event, and funding opportunities. Of course, our sponsors offer their expertise, knowledge, and various topics, and then we also work with them to organize skill building webinars. And of course, you would be hearing from them soonest. Thank you all once again for joining. We'll be posting this webinar recording directly on Facebook soon. We couldn't do that while we were this session was going on because I think Facebook had some cyber issues. So thank you once all for joining again. We say Asante Sana. All right, bye everyone.
Bye.
All right, thank you. Yeah.